Hello, my name is Leslie. Welcome to episode 2 of the Complete First Year series. I know you're doing your best to be a good mom for your new baby. You're exhausted. You've read everything you can find on the internet about babies, with conflicting information, leaving you even more confused. I will bring clarity to you in this series. The series was developed by Dr. Greg M. Ogi, a pediatrician with 37 years of experience who has helped over 2,000 families walk through this journey, from the birth of a new baby to the first birthday party. Subscribe now, and let's work together to turn your stressful days and sleepless nights into joyful days and restful nights. Let's get started. Coming home, the first 2 weeks. You just got home with your new baby. Congratulations! Now what? If you're feeling a mixture of excitement, terror, and complete overwhelm, you're absolutely normal. These first 2 weeks are unlike anything you've experienced. They're beautiful and hard in equal measure, often simultaneously. I'm going to walk you through what to expect, what's normal, and how to get through these early days. By the end of these 2 weeks, you'll have more confidence, your baby will be settling in, and you'll start to see glimpses of a routine emerging. Let's take this one day at a time. Want the complete guide with every detailed strategy? Get the book, The Complete First Year by Dr. Greg M. Ogi on Amazon. The link is right here in the description. We just covered one piece here. The book gives you everything. Click that link, get your copy, subscribe for more videos, and let's transform your days and nights starting today. The first 24 hours at home. Survival mode activated. You walk through your door with this tiny human who is now completely your responsibility. If you feel a moment of panic, that's normal. Every parent has that moment. Here's what's really happening. Your baby has just left the only environment they've ever known. Warm, dark, with constant white noise and gentle movement. Everything in the outside world is new and potentially overwhelming. Lights, sounds, space, stillness. You've just been through labor and delivery, which is physically and emotionally intense. If you gave birth, your body has been through major trauma. Yes, even easy deliveries are traumatic to your body. If you're the partner, you've been through an emotional marathon. Nobody is sleeping much. Your baby sleeps a lot, but in short bursts. You're wired on adrenaline and anxiety, your basic survival checklist. Feed baby every 2 to 3 hours, or on demand. Change diapers frequently. Sleep when baby sleeps. Seriously, ignore the housework. Drink water. Dehydration makes everything harder. Eat something, even if it's crackers and cheese. Take a shower if you can. You'll feel more human. Ask for help if you need it. That's it. If you accomplish those things, you've succeeded. Understanding your newborn's basic needs. Your baby has simple needs right now, even though meeting them feels complicated. Food. Breast milk or formula every 2 to 3 hours, sometimes more often. Sleep. 16 to 18 hours total per day, but in 45-minute to 3-hour chunks. Diaper changes. 8 to 12 wet diapers per day after your milk comes in. Comfort. Being held, hearing your voice, feeling secure. Warmth. Being dressed appropriately, 1 layer more than you're wearing. That's really all they need. They don't need stimulation, entertainment, or fancy toys. They need food, sleep, clean diapers, and you. Feeding in the first 2 weeks, the main event. Whether you're breastfeeding, formula feeding, or doing both, feeding will dominate your life for the next 2 weeks. That's completely normal. Breastfeeding reality check. If you're breastfeeding, here's what nobody tells you. Days 1 to 2. Your baby gets colostrum, thick, yellow, liquid gold full of antibodies. It's perfect nutrition even though the amounts are small. Your baby's stomach is the size of a marble, so small amounts are appropriate. Days 3 to 5. Your milk comes in. Your breasts feel full, hard, maybe painful. This can be uncomfortable but usually eases within 24 to 48 hours. Feed frequently to relieve the fullness. Week 1 to 2. You and baby are learning together. It may hurt at first, shouldn't be excruciating. If it is, seek help. Nipples may be sore. You'll feed 8 to 12 times per 24 hours. Cluster feeding, multiple feeds close together, is common, especially in evenings. What's normal? Feeding every 2 to 3 hours, or more often during cluster feeds. Feeding sessions lasting 20 to 45 minutes. One breast producing more than the other. Baby feeding more frequently during growth spurts. Leaking milk between feeds. Feeling thirsty while nursing. Falling asleep while nursing. What's not normal? Call for help. Severe pain throughout the feeding. Cracked, bleeding nipples that don't improve. Baby not waking to feed. Fewer than 6 wet diapers per day after day 5. Baby seeming lethargic or uninterested in feeding. Fever over 100.4 degrees Fahrenheit in you or baby. Red streaks on your breast or hard, painful lumps. Getting help. If breastfeeding is painful or difficult, contact a lactation consultant. Most hospitals have one you can call. This is not admitting failure. This is getting skilled help for a learned skill. Many breastfeeding problems are fixable with proper support. Formula feeding reality check. If you're formula feeding, here's what you need to know. Formula amount. Newborns typically take 1 to 3 ounces per feeding for the first few days, increasing to 2 to 4 ounces by 2 weeks. Your baby will let you know if they want more, rooting, sucking, or are done, turning away, falling asleep. Frequency. Every 2 to 4 hours or 8 to 12 times per 24 hours. Preparation. Follow formula instructions exactly. Don't add extra water or extra powder. Use safe water, bottled or boiled and cooled if your water quality is questionable. Warm bottles by running under warm water or placing in warm water, not in the microwave, creates hot spots. Formula is good at room temperature for 1 hour, in the fridge for 24 hours after mixing. What's normal? Baby wanting different amounts at different feedings. Some spit up after feeds. Burping needed. Bowel movements changing color, consistency, yellow-brown, seedy, or paste-like. What's not normal? Call your doctor. Baby refusing multiple feeds in a row. Projectile vomiting. Fewer than 6 wet diapers per day after day 5. No bowel movements for several days combined with hard belly. Blood in vomit or stool. Baby seems in pain while feeding or after. The beautiful thing about formula. You know exactly how much your baby is eating. Your partner can share feeding duties equally. You can leave baby with someone else without worrying about pumping. These are real advantages. Combination feeding. Some families use both breast and bottle. This can work well, but requires a bit more planning. If you're breastfeeding and supplementing, nurse first, then offer formula. If pumping and supplementing, treat pumped milk and formula as separate. Don't mix in the same bottle. If transitioning between methods, go gradually. Burping basics. Whether breast or bottle feeding, most babies need burping. 3 positions that work. 1. Over your shoulder, patting or rubbing their back. 2. Sitting up on your lap, supporting their chest and head, patting their back. 3. Lying on your lap face down, patting their back. Burp halfway through feeding and at the end. Some babies need more frequent burping, some hardly need any. You'll figure out what your baby needs. Diaper duty. What goes in must come out. Diapers will consume your days and nights for the next few years, but they're especially important in these first 2 weeks because they tell you if your baby is eating enough. What to expect. Days 1 to 2. Black, tarry poop, meconium. 1 to 2 wet diapers. Days 3 to 4. Poop transitions from black to greenish to yellow. More wet diapers. Days 5 to 14. Yellow, seedy poop, breastfed, or tan, paste-like poop, formula-fed. 6 to 8 plus wet diapers per day. Multiple poops per day. Some babies poop after every feed, some go days between. Both can be normal. Diaper math. By day 5, you should see at least 6 heavy wet diapers per day. Several poops per day, generally 2 to 3 or more. Diaper changing basics. You'll get fast at this. For now, have everything ready before you start. Never leave baby unattended on changing surface. Wipe front to back, especially for girls. Let diaper area air out when possible. Apply diaper cream if redness appears. Expect to change 8 to 12 diapers per day. Diaper rash. If baby's bottom gets red, change diapers more frequently. Let baby go diaper-free for short periods. Use barrier cream. Zinc oxide works well. Avoid wipes if very irritated. Use water and soft cloth instead. If it doesn't improve in 2 to 3 days or looks severe, call your doctor. Sleep, or lack thereof. Let's be very honest. You're not going to sleep much these first 2 weeks. Your baby will sleep 16 to 18 hours per day, but in short bursts, and not necessarily when you want to sleep. Newborn sleep reality. Nothing prepares you for the sleep deprivation of those first weeks. Your baby will wake every 2 to 3 hours around the clock, and there's no magic trick to change that immediately. But understanding what's normal and what helps can make it survivable. Your baby cannot yet distinguish day from night. Their circadian rhythm isn't developed. They sleep based on feeding needs, not on a schedule. Normal newborn sleep. 45 minutes to 3 hours at a stretch. Waking every 2 to 3 hours to feed. Sleeping more during the day than night. Sometimes it varies. Making lots of noise while sleeping. Grunting, squeaking, snorting. Moving around and seeming restless even while asleep. Your baby is not a good sleeper or bad sleeper. They're a normal sleeper. The babies who sleep 5-hour stretches at 1 week old are the outliers, not the standard. Safe sleep reminders. Every time you put baby down to sleep. On their back. On a firm, flat surface. In a crib, bassinet, or play yard. Nothing else in the sleep space. No blankets, pillows, toys, bumpers. Room temperature comfortable, 68 to 72 degrees Fahrenheit. Consider a pacifier, reduces SIDS risk. If baby falls asleep while feeding, that's fine for that moment, but move them to their safe sleep space when you can. Parent sleep strategy. Sleep when the baby sleeps sounds impossible, but it's your best option. Ignore the dishes, laundry, and mess. Turn off your phone. Darken your room. Lie down every time baby sleeps. Even if you can't fall asleep, rest. Your body needs sleep to heal, if you gave birth, and to function, everyone. Prioritize sleep over everything else right now. Partners, your role is crucial here. You can. Bring baby to nursing parent for night feeds, then take baby to burp and change. Take 1 full feeding overnight so your partner can sleep a longer stretch. Handle everything except feeding so your partner can sleep between feeds. Protect your partner's sleep during the day. Handling the baby. Building confidence. If you've never held a newborn before, they can seem terrifyingly fragile. They're actually more resilient than they look, but they do need proper support. How to hold your baby. The key is supporting the head and neck since babies can't control their heads yet. Common holding positions. Cradle hold. Baby's head in the crook of your elbow, your forearm supporting their back. Football hold. Baby along your forearm, face up, head in your hand. Over the shoulder. Baby upright against your chest, head on your shoulder, supporting their bottom. Belly down. Baby lying along your forearm, face down, head turned to the side. All of these are fine. Use what's comfortable for you and baby. Handling tips. Always support the head. Keep baby close to your body, They feel more secure. Be confident. Babies sense nervousness. Talk to your baby while handling them. It's okay if their head wobbles a bit. You're not going to break them. What about the soft spot? The fontanelle or soft spot on top of baby's head is protected by a tough membrane. You won't hurt it by touching or washing it gently. It's supposed to be there. It allows baby's head to pass through the birth canal and allows room for brain growth. The startle reflex. Your baby has a startle reflex or Moro reflex that makes them throw their arms out and seem distressed when they feel like they're falling. This is normal and will go away by 3 to 4 months. Swaddling helps calm this reflex. Swaddling. Wrapping baby snugly in a blanket can help them sleep better and feel secure. YouTube has excellent swaddling tutorials. Key points. Not too tight around hips because of hip dysplasia risk. Stops when baby shows signs of rolling, usually not in these first 2 weeks. Some babies love it, some hate it. Crying, the universal baby language. Your baby will cry. A lot. In those first weeks, it might feel like your baby is crying constantly, and you'll wonder what you're doing wrong. Here's the truth. Crying is your baby's only way to communicate, and you're not doing anything wrong. Let's talk about what all that crying means and how to respond. Your baby is going to cry. Sometimes you'll know why, sometimes you won't. This is normal, and it doesn't mean you're a bad parent. Why babies cry. Newborns cry to communicate. They're saying, "I'm hungry," most common. "I'm uncomfortable." Dirty diaper, too hot or cold. "I'm tired." But ironically, crying keeps them from sleeping. "I'm overstimulated." Too much noise, light, activity. "I need to be held." "I'm in pain." Gas, reflux, illness. "I don't know, I just need to cry." Yes, this is real. Normal crying amounts. Average newborns cry 2 to 3 hours per day total. This peaks around 6 weeks, then gradually decreases. Some babies cry more, some less. Both are usually normal. The 5 S's for soothing. Dr. Harvey Karp's method. When your baby is crying and you've ruled out hunger and dirty diapers, try these in order. 1. Swaddle. Wrap baby snugly. 2. Side or stomach position. Hold baby on their side or stomach. Never sleep this way, just for calming. 3. Shush. Make loud shh sounds near baby's ear. 4. Swing. Gentle, rhythmic motion. 5. Suck. Offer pacifier or let baby suck on your clean, washed finger. These mimic the womb environment and can be very effective. Other soothing strategies. Skin-to-skin contact. Walking while holding baby. Car ride. White noise. Singing or humming. Warm bath. Fresh air. Take baby outside. Change of scenery. Sometimes nothing works. There will be times when nothing soothes your baby and they just need to cry. If you fed them, checked their diaper, made sure they're not hurt or ill, and tried soothing, sometimes you just have to hold them while they cry and ride it out. It's okay to put baby down in a safe place and take a 5-minute break if you're getting overwhelmed. Baby will be fine crying in their crib for a few minutes while you collect yourself. When crying might signal a problem. Call your doctor if crying is accompanied by fever 100.4 degrees Fahrenheit or over. Crying is different, higher pitched, weaker, or constant. Baby seems in pain. Baby won't eat. Baby is lethargic when not crying. You see other concerning symptoms. Your instinct says something is wrong. Trust your gut. You know your baby. If something feels off, call. Purple crying. Some babies have periods of inconsolable crying, especially in the first few months. It's called purple crying. Peak. Peaks around 2 months. Unexpected, for no clear reason. Resists soothing. Nothing helps. Pain-like face, but not in pain. Long-lasting, can go on for hours. Evening, usually worse in evening. This is a real phenomenon and it's not your fault. It does pass. If you're experiencing this, seek support. It's exhausting. Basic baby care tasks. Let's cover the routine care tasks you'll do constantly. Umbilical cord care. Your baby's umbilical cord stump will fall off in 1 to 3 weeks. Until then, keep it dry. Fold diaper down so it doesn't cover the stump. Don't submerge baby in bathwater. Sponge baths only. Don't pull on it. A little bleeding when it falls off is normal. A little oozing is normal. Call your doctor if area looks red or swollen, pus or bad smell, baby has fever, stump hasn't fallen off by 4 weeks. Bathing. Sponge baths until the cord falls off. Then you can do real baths. Sponge bath. Get everything ready first. Warm room. Warm water in a bowl. Wash face first, no soap. Then body with gentle baby soap. Pat dry thoroughly, especially in skin folds. Lotion is optional. Baby's skin produces its own oils. Real bath, after cord falls off. Use baby tub or sink. 2 to 3 inches of warm water. Test with your elbow. Support baby's head at all times. Wash face first, then body, then hair last. Baby doesn't need a bath every day. 2 to 3 times per week is good. Many babies cry during baths at first. They'll get used to it. Nail care. Baby fingernails grow fast and they can scratch themselves. Options. Baby nail clippers, easier than scissors. Nail file, safest. Best time, when baby is sleeping. If you accidentally cut too close and draw blood, it happens, apply pressure with clean cloth. It will be fine. Diaper area care. Clean thoroughly at every change, but be gentle. Use warm water and soft cloth or fragrance-free wipes. For girls, wipe front to back always. For boys, if not circumcised, don't force foreskin back. Just clean what you can see. Circumcision care, if applicable. Follow your doctor's specific instructions. Usually heals in 7 to 10 days. May have some yellow discharge while healing. Normal. Apply petroleum jelly to prevent sticking to diaper. Call if you see active bleeding, increasing redness, or signs of infection. Going to the pediatrician, your first visit. Most pediatricians want to see your baby within 3 to 5 days after coming home from the hospital. Some will see baby even sooner if there are concerns. What to bring? Diaper bag with essentials. Insurance card. Any paperwork from the hospital. List of questions. Your partner if possible. What will happen? Weight check. Baby likely lost some weight since birth. Normal to lose up to 10%. The goal is to be back to birth weight by 10 to 14 days. Physical exam. Doctor will check everything from head to toes. Feeding assessment. You'll discuss how feeding is going. Jaundice check. Looking at baby's skin and whites of eyes. Questions. This is your time to ask anything. Questions to ask your pediatrician. How is baby's weight? Is the umbilical cord healing properly? Is the circumcision healing well, if applicable? Are we feeding the right amount? Is baby's poop normal? How many wet diapers should we see? When should we come back? What should we call about versus what can wait? How do we reach you after hours? Write questions down before the appointment. You'll forget otherwise. Your physical and emotional recovery. If you gave birth, your body has been through an intense physical event. Recovery takes time. Physical recovery, birth parent. While everyone focuses on the baby, your recovery matters just as much. Whether you had a vaginal delivery or C-section, your body has been through something incredible and needs time to heal. Let's talk about what's normal and what needs attention. Weeks 1 to 2 you might experience Bleeding, lochia, that's heavy at first, then tapers off. Cramping, especially while nursing, uterus contracting back to size. Soreness, vaginal birth, or incision pain, C-section. Breast engorgement when milk comes in. Hemorrhoids. Constipation. Drink water, eat fiber, ask doctor about stool softener. Exhaustion. Night sweats. Hair loss. This comes later, around 3 months. What helps? Rest as much as possible. Stay hydrated. Take pain medication as prescribed. Use ice packs, warm baths, witch hazel pads for discomfort. Accept help. Don't lift anything heavier than your baby. No exercise beyond gentle walking yet. Call your doctor if bleeding suddenly gets much heavier, soaking a pad in an hour. Fever 100.4 degrees Fahrenheit or over. Severe pain not helped by medication. Signs of infection, increasing redness, pain, discharge with odor. Difficulty urinating or having bowel movements. Severe headache or vision changes. Emotional changes. The baby blues affect about 80% of new mothers. Feeling weepy or emotional. Mood swings. Anxiety. Feeling overwhelmed. Trouble sleeping even when baby sleeps. This is normal and usually peaks around day 4 to 5, then improves within 2 weeks. However, about 15 to 20% of new parents develop postpartum depression or anxiety. Persistent sadness or hopelessness. Loss of interest in things you normally enjoy. Difficulty bonding with baby. Thoughts of harming yourself or baby. Extreme anxiety or panic attacks. Feeling like you're a terrible parent. Unable to care for yourself or baby. If you're experiencing these symptoms, call your doctor immediately. Postpartum depression is treatable and not your fault. You're not weak or failing. You have a medical condition that needs treatment. Partners can experience this too. Non-birthing partners can develop postpartum depression and anxiety as well. If you're struggling, get help. Your mental health matters too.
Want the complete guide with every detailed strategy? Get the book, The Complete First Year by Dr. Greg M. Oji on Amazon. The link is right here in the description. Click that link, get your copy, subscribe for more videos, and let's work together to turn your stressful days and sleepless nights into joyful days and restful nights.